Thank you, Mr President. Those who followed my contributions in this chamber and in the community would know I have an abiding interest in rural mental health. I've travelled widely across Australia talking to people about the challenges of getting mental health support in the bush and what mental health services should or could look like for people who live outside city limits. We know that people in the country have unique pressures on their mental health and often don't have a psychologist or mental health nurse around the corner who can provide support. Even getting to a GP for primary care or a referral can mean a 3-hour car trip and a great deal of stress. Too often, people in the country are forgotten and fall victim to a crisis-centred system where they can't get access to mental health services until they're experiencing a crisis and then face being transferred away from their community for treatment. One of my goals for my time in Parliament is to keep a focus on mental health, and particularly rural mental health, simply because, for those who live in country Australia, it can be a matter of life or death. Country Australians are losing people, fathers, sisters, friends and children to suicide, and it shatters entire communities. During Mental Health Week in October, I conducted a survey to follow up on my rural mental health consultation. Technically, my consultation concluded in 2013, but in many ways it has never really ended. The survey results were damning and dispiriting. Of those who responded, only 6% of people working in the mental health sector felt that their region had sufficient mental health services for the needs of their community. And only 7% of people thought that those in their community were able to access care before reaching a crisis stage. Poor access to subacute services, that is, services before a crisis hit, and the need for better community-based care were two issues identified as key areas for improvement in the survey. This is consistent with the findings of my rural mental health consultation, where I was told that people wanted a mental health safety net, not an ambulance. An overwhelming number of people said it was difficult to attract staff to work in rural areas. Again, this is one of the key issues which mental health workers in rural and remote areas have raised with me. They talk about care. In terms of culturally appropriate care and the need to grow your own workers so that workers understand the unique aspects of rural communities and will stay. We need a rural mental health workforce plan to address the alarming shortage of rural mental health workers who are willing to go to country areas. A lack of training and support for mental health workers in rural areas was also identified by survey respondents as a significant issue in need of attention. 67% of rural mental health workers said that rural mental health did not receive a lot of media attention. We saw during Mental Health Week, thanks to the ABC, what a difference it makes when the national conversation turns to mental health and we get to hear powerful stories both of mental health challenges and recovery. It reinforces the reality that we all experience mental health peaks and troughs in our lifetime, and that's okay. The survey results provided a damning report card for the Abbott government when it comes to mental health. When asked to rank the Abbott government's performance on rural mental health to date, almost half gave the government the lowest possible score and 80% gave an unfavourable ranking. 89% of mental health workers who responded said there should be a dedicated federal mental health minister. When it came to respondents who have lived experience of mental ill health, they rated stigma as one of the most significant issues faced by people in country areas. People have said that the distress of the stigma they have experienced as a result of their mental ill health often stays with them long after they've recovered from the mental ill health condition. Stigma is something that we as a country must address seriously. We are one of only 2 OECD countries without a national anti-stigma program. I will continue to put pressure on the government to take stigma seriously. And I'm not just talking about a glossy, temporary advertising campaign, but a consistent, evidence-based education campaign that starts with young people and is informed by the experience of those who live with mental ill health. Stigma is often acutely felt by young people in the country, many of whom turn to the Kids Helpline or online services like the wonderful reachout.com website for support in the privacy of their own homes. Just last week, the National Children's Commissioner handed down her Children's Rights Report 2014, which focused on self-harm and suicide among young people. This is yet another distressing report which details the extent of mental distress experienced by people as young as 9 or 10 years old, and tragically sometimes even younger. In her report, the Commissioner identifies children and young people in rural areas as being disproportionately affected by intentional self-harm and suicide. Ratios for death due to intentional self-harm among young men are particularly high, with some estimates finding that it occurs at almost twice the rate as in metropolitan areas. The Children's Commissioner cites Suicide Prevention Australia, who suggests that factors like underemployment, lack of infrastructure, including health and education services, restricted social and career opportunities, drought and cultural stoicism may contribute to the distress of young people in rural Australia. Children and young people with mental ill health also often experience a lack of services and access to information in rural Australia. The data in the Children's Rights Report 2014 makes for bleak and confronting reading. It's clear we have a serious problem in Australia. It shows that each week 1 child dies by suicide in Australia, and between 50 and 60 are hospitalised for attempting to suicide. The data also shows that children from an Aboriginal or Torres Strait Islander background, aged 4 to 9, are twice as likely to suicide as others the same age. Yes, I said 4 to 9. And that the suicide rate among Aboriginal teenagers is 5 times higher than for other teens. It also highlights other particularly vulnerable groups: rural youth, as I mentioned, and also children and young people who have a disability, those who are in out-of-home care, those from a CALD or culturally and linguistically diverse background, and those who are sexuality or gender diverse. What the data doesn't show is what it is that is leading our young people to harm or kill themselves in increasing numbers, or why a generation of young people is apparently losing hope. This is the conversation we must have, the research we must do, the exploration we must pursue. The Children's Commissioner has made some very practical and detailed recommendations to the government which indicate how this alarming loss of life and hope can be addressed. These include a national research agenda and better and more consistent standardised data and reporting and surveillance from across the states and territories. I look forward to seeing the government's response to this comprehensive report so we can work together in this parliament towards solutions to get our precious young people the support they need before it's too late. I am concerned that since 2010, when mental health was a word on everybody's lips, it's gone off the federal government's radar. It's clear to me that we need a dedicated federal mental health minister to halt the decline, to show the Australian community that the federal government takes mental health seriously so that we have national leadership, and to ensure that mental health gets attention and funding commensurate with its impact and the burden of disease and lost productivity it brings with it. It affects all of us. In the course of my rural mental health survey, it emerged that only 8% of mental health workers felt that mental health was a priority for their local parliamentarian. At a time when more teenagers are dying by suicide than in car accidents, and given that nearly half of us will experience mental ill health at some point in our lifetime, mental health should be a priority for every parliamentarian across Australia. This is about the heart of our nation's well-being. I urge my colleagues here and in the other place to make it a priority.